What is a lobotomy? A lobotomy is a type of psychosurgery that was used between the late 1930s and the late 1960s to treat people with mental illnesses. As defined by the World Health Organization, psychosurgery is the selective surgical removal or destruction of nerve pathways for the purposes of influencing behavior. People who had lobotomies were often those who suffered from depression, schizophrenia, obsessive-compulsive disorder, and bipolar disorder. But sometimes people given lobotomies weren't mentally ill at all. Aside from those with mental illness, practitioners also performed lobotomies on those who had intellectual disabilities, were a part of the LGBTQ+ community, and were prisoners. The lobotomy was first invented in 1935 by Portuguese neurologist and statesman Antonio Egas Manes. At that time, it was referred to as the leucotomy and not the lobotomy. Dr. Walter Freeman later renamed it the lobotomy in 1936. Many people believe that Walter Freeman was the one to invent the lobotomy, but that's simply not true. He may not have been the one to invent it, but he was a very significant part of its history. He was the one to invent the ice pick lobotomy, and he performed over 3,000 prefrontal lobotomies between the 1930s and the 1960s. The first ever ice pick lobotomy was performed on January 17, 1946, on 29-year-old housewife Sally Ellen Ionesco. She was extremely depressed and suffering from suicidal thoughts at the time. Sally's daughter, Angeline Forrester, was there the day she had the lobotomy.
But afterwards, she resumed not quite as vivacious as she was. It was never back again. But she came back. She was the person I knew before. And I felt like he had given me a tremendous gift to give my mother back to me. And not, I guess, to my father, it was not to have to institutionalize her. It's a hard decision to make. But inevitably, life is just full of decisions like that. I mean, just jobs alone. You have to compromise. And that's basically what it is. I don't know if it was a good thing or a bad thing. For me, it was a good thing. I think for Mama, it was a good thing. And I think the lobotomy he did on her was a very good thing. Certainly the electroshock therapy was. Of course, now they have medicine for this. So it's all moot point. But they had nothing back then. That's the thing people who are looking at it don't understand. They didn't have anything else. And nobody was coming up with anything.
Angeline believed that the surgery was beneficial to her mother and her family. She stated that after the lobotomy, her mother was never quite herself again, but perhaps that was a good thing. Angeline is glad her mother received the lobotomy, and she believes it was necessary to cure her of her mental illness. Sally Ellen Ionesco was the first of many people to receive a lobotomy. During its short-lived fame, somewhere between 40,000 and 60,000 people were given lobotomies. Around 10,000 of those were ice pick lobotomies, and an astounding 3,000 to 4,000 were performed by Dr. Walter Freeman. Out of most patients, Howard Dooley is seen as one of the most famous patients who received a lobotomy from Dr. Walter Freeman. Howard received a lobotomy when he was 12 years old, but Dr. Walter Freeman diagnosed him with schizophrenia at the age of 4. When other psychiatrists examined Howard, they didn't find any signs of mental illness and instead blamed his symptoms on his stepmother Lou. The following 3 disturbing photos are of Howard Dooley before, during, and after his transorbital lobotomy. His eyes appear black in this photo due to the large number of blood vessels around the eyes. When ruptured, the blood pools on the loose skin on the face. This image is an excerpt from Howard Dooley's medical records right after his lobotomy. The following clip is of Howard discussing the lobotomy he received from Dr. Walter Freeman.
I've always felt that something was taken from me, that there's a piece missing because my life has never gone well. I've had trouble almost all my life, either in relationships, almost anything I did, work, relationships, money, people caring, people understanding, family, having the family I wanted to have, I still want to have. We're not close, you know. I guess a lot of families aren't, but that's not the way I wanted it to be. And I'm not sure that we're not close because of the operation or things that transpired between all of us. But that's the only thing I can come up with, because that's all I've lived. Day after day after day, what has this done to me? Why am I not in management? Why am I not in a suit and tie? Why am I not making a decent living? You know, and constantly struggling and fighting to get up to what other people have, and just not seeming to be able to make it. You know, you get close to it and you just don't get there.
Although Howard was extremely famous for his lobotomy, likely the most famous lobotomy victim was Rosemary Kennedy. Rosemary Kennedy was known as one of Mr. Freeman's most famous failures. He performed the lobotomy in the summer of 1941 with his neurosurgeon partner James Watts. Rosemary received a prefrontal lobotomy ordered by her father because he stated she suffered from intense emotions and aggressive mood swings. She actually seemed like a relatively normal woman that just had some behavioral and developmental issues. Many believe this was because of the anoxia she was diagnosed with when she was born. Today, this would most likely fall under the umbrella of the autism spectrum. Following her lobotomy, Rosemary lost most of her ability to walk and talk. It was very clear that something had gone wrong during her surgery. Her personality changed drastically, and immediately after she was discharged from the hospital, she was institutionalized for the rest of her life. She died in 2005 at the age of 86 due to natural causes. Lobotomy mortality rates ranged from 5% to 14% during the life of the lobotomy. Most deaths were caused by brain hemorrhages, including Walter's final patient, Helen Mortensen. There isn't much information about Helen, but according to sources, she received a total of 3 lobotomies performed by Dr. Walter Freeman and sadly died of a brain hemorrhage shortly after her 3rd procedure in 1967. Lobotomies gradually stopped being performed due to the very high complication rate, such that they were considered dangerous and unethical. Today, there are more effective and less dangerous ways to treat mental illnesses. Examples of treatments are medication, therapy, and healthier psychiatric wards that generally help the mentally ill. Psychosurgery is still performed today, but only in highly specific or extremely rare cases. Even when it is performed, it's highly refined and differs from the original lobotomy. In conclusion, the lobotomy had very mixed feedback. For some, it worked and cured them, or at least improved their quality of life. For others, it left them permanently disabled, and for others, it sadly caused them to lose their lives. The lobotomy reformed how mental illness is treated today and how it's viewed from outside perspectives all around the world.